Hi there. In this video, we're just going to show you some of the features about how you would set up when you're first starting off. So what I'd like you to do is go to the admin section, and this will bring about all the admin tools which are available. You can set up your sites. If you've got more than one site, you can add an additional site here. Staff. So we've got 4 staff members already here, but if you're adding an additional staff member, this is where they will go. And as GPRota does clinical and non-clinical, you put your entire workforce in here, including any locums that will work in the practice or will be in your locum bank. And locums could be any type of staff member. Doesn't have to be a clinician, doesn't have to be a doctor. It could be a nurse, it could be a receptionist or a read coder. Anybody that works in your practice could potentially be a locum that you might rely on. So it could be a secretary, or whether it's a staff member within your PCN. Sessions. So we put 2 down here: joint injection and care home. We'll add an additional session. So this might just be a normal surgery. It's a clinic session. It's not any of the leaves or others. You've got a whole range to choose from. It's an active session. You're seeing patients. It's not an annual leave session. And this session is only really for clinicians. So I'll put clinicians, and you can allocate a color to a particular session as well. So we'll just pick one color here. Added a session there. In relation to the session times, again, this is a way that you can quickly identify, when a particular shift is. So instead of having to write down the start time and the end time, you can give it a name. So a morning clinic, maybe between 8 and 1, or in your practice, and maybe a little bit later. So we can just change that, maybe 9 o'clock, finishing at 12, perhaps. And again, you can have a whole range of different named session times here. You can pick off from rooms. Here we've added some rooms in already, but we'll just show you how we'd add an additional room. It'd be an idea to map out your entire practice, all the clinical rooms, all the reception areas as well. And so it doesn't have to be rooms, although it's titled rooms. Some practices have used this tool quite innovatively in relation to workstations. So make sure that all the reception staff are working fair distance apart in relation to the current pandemic. So we'll add a room here. So if there's more than one practice, you can choose which practice that room's in. Give an ID if you want. And then the room name. So I'll just call this room 12. And who uses this room? Is it clinicians? Is it staff? Or is it both? I'll say that in room 12 it's just the clinicians. So I'll just take the clinicians there. And that room, there it is. Templates, this is more for when there are certain doctors or staff members that work on a particular fixed shift on a particular day or a time in a room, and so you can create a weekly rota. Just one example here. So we know that Goofy works on a Monday between 1 and 6. So does it 8 to 1 in the morning as well. So that's all day, but they do different shifts. And again, Mickey Mouse, we've got him working morning and afternoon on Tuesday. Of course, if their shifts change, you can just move them across. Okay. And you can have, if you have a rota, 1 in 4 rota in your practice, you can have week 1, week 2, week 3, week 4. Or there's a whole range of different ways that you can create fixed rotas and you can add them in. And this applies for your clinical staff and your non-clinical staff as well. So you have several different templates. Staff work documents. Well, this is where their important documents can be held. Also, you can attach an expiry date to them. So close to the expiry, it'll inform the staff member, but also the admin that this information needs updating. So it's a good way of keeping up to date with all the information and see that their employment certificates are kept up to date, so they're able to work. We've got various tools here: rota checker, conflict checker. We'll go through these in the next video.